On a chilly fall afternoon in 2021, a woman named Ruth Jones pushed her grandson's stroller through the Boston Common, a beautiful city park in Boston, Massachusetts. Ruth beamed with pride as people leaned in to get a look at 8-week-old Tommy, who was cooing and gurgling in his stroller. This was one of Tommy's very first excursions outside of the house, and he was bundled up so much that he almost looked like a little burrito with big brown eyes, fascinated by the treetops overhead and all the new faces waving hello. Ruth walked them around the pond, marveling at all the autumn foliage in the park, then sat down on a bench across from her favorite people-watching spot, the vintage carousel with hand-painted wooden horses and zebras. She turned Tommy's stroller so he could see the flashing lights and hear the lively organ music, but after a moment, Tommy started to cry. And so Ruth turned Tommy around and tried to calm him down, but it was like nothing she could do could get the boy to stop crying. Ruth's daughter Emily had warned her that Tommy had been very irritable lately. So she picked Tommy up out of the stroller and cradled him to her chest, thinking that might calm him down. But he just continued to wail in her arms, almost like he was actually in pain. Ruth then tried to give Tommy a pacifier, something he normally liked, but he wouldn't take it. And if anything, it just seemed to make him even more upset. Ruth wondered if maybe he was hungry, but she didn't have a bottle with her, so she decided it was time to take Tommy home. Tommy cried the entire way back. By the time Ruth got him to her daughter's house, his voice was hoarse. Now, at this point, Ruth did feel very sorry for Tommy. She didn't know what was going on, and obviously he was very upset. But if she was being honest, all this persistent crying was actually now giving Ruth a bit of a headache. And so she carefully brought Tommy into the kitchen, and she put the kettle on the stove for tea, and then put Tommy's bottle in a warmer. And while the milk was warming, she set out a teacup, put a tea bag in, and also got some honey out. All the while, Tommy just continued to wail and cry on her shoulder. Once Tommy's bottle was warm, Ruth tried to give it to him, but he was so upset he wouldn't take it. And so now Ruth was sort of out of ideas and really didn't know how to calm Tommy down. And so she just began walking around the kitchen, patting her grandson on the back and, doing everything she could to be motherly, but Tommy just kept on wailing and wailing. And then Ruth remembered that her daughter and son-in-law had said something about giving Tommy something sweet when he had been really upset these past couple of weeks. But Ruth looked around the kitchen and couldn't find anything that fit the description and didn't feel comfortable just giving him something random. And so ultimately, Ruth just sort of walked around the kitchen as Tommy screamed for the next few hours until finally Ruth's daughter Emily came home and took Tommy from her. 6 days later, Ruth was at Tommy's pediatrician's office, holding the crying baby to her chest while trying to fill out a clipboard of check-in forms. Over the past week, Tommy's meltdowns had gotten longer, louder, and more frequent. Ruth and Emily were both worried that something was genuinely wrong with him, and so Emily had scheduled this doctor's appointment for Tommy. But today, Emily had to work, and so Ruth had taken the baby. When they finally got called back to the examination room, Tommy's crying only seemed to get worse. And so the pediatrician, upon seeing Tommy, sort of furrowed her brow as she began conducting a routine physical exam. And as she did, Ruth explained that these crying fits had been going on like this for a full week. The pediatrician nodded as she touched the right side of Tommy's abdomen, and as she did, Tommy wailed harder and louder than Ruth had ever heard. She jumped to her feet out of instinct, genuinely horrified by the noise coming from her grandson. But the pediatrician just shook her head and said not to worry. She now knew what the problem was. There was gas stuck in his tiny stomach. The pediatrician then showed Ruth some exercises to do on Tommy, and she literally began pedaling Tommy's legs and folding them up and down and rubbing his stomach to help him pass the gas. And as she did that, in demonstration for Ruth, it did seem like Tommy was calming down just a little bit. However, by the time Ruth and Tommy were back home again, Tommy was wailing all over again. And so Ruth carried him up to the nursery and ran him through all those exercises she had been shown on his changing table, and he did pass some gas and he did start to quiet down. And for a second, Ruth felt relieved, like they were onto something, that they had really figured out what was wrong here and they were slowly making it better. But the second she picked Tommy up again, he started to cry again. Ruth was at a loss. She just couldn't seem to keep him calm. She paced the hallway with him, and she also just stopped and rocked him back and forth. She carried him up and down the stairs. She sang lullabies, but nothing worked. A few hours later, when Emily got home from work, Ruth almost cried with relief. She handed Tommy off to Emily the moment her daughter stepped through the door. Ruth was obviously still very concerned for Tommy, but she also desperately needed a break from the constant crying. It had just gotten worse all afternoon. His screaming was relentless. And now, as she walked outside down towards her car, she could still hear him crying in the house. And as Ruth drove back to her home, all she could think about is what's going on with Tommy. Half an hour later, back at Emily's house, Emily sat in the nursery with Tommy trying to feed him. Downstairs, she could hear her husband Dave in the kitchen making dinner. And even though Emily was hungry, she knew she had to give Tommy his own dinner before she could eat. And that was proving much more difficult than usual. Now, Tommy had always been a fussy baby, but nothing like the last week. The only time Emily noticed her son seemed even remotely calmed down and happy was when he was nursing, or when they dabbed a trace of honey on his pacifier and actually got him to use it. And so Emily rocked Tommy, and finally he did latch on, and he began breastfeeding, and at that point he did sort of quiet down. Except as he was eating, Emily noticed that he was not latching onto her breast as firmly as he usually did. As the minutes went by, she noticed that he seemed to be drinking less and less milk too. She wondered if maybe it was just because he was so tired from all the crying. A minute later, he'd stopped drinking completely and was fast asleep. Emily thought that maybe he wasn't all that hungry, so she put him in his crib and joined Dave downstairs for dinner. The next morning, just before dawn, Emily was back in Tommy's nursery, back in the armchair she used for nursing, but Tommy was not latching. No matter what she did, she could not get him to begin to breastfeed. Not even in the weak way he'd done the night before. It was just like he wasn't doing it. She knew Tommy had to be hungry, but she had no idea how to get him to actually eat. At this point, Emily felt like Tommy's behavior was more than just typical baby fussiness. And so when her husband appeared in the doorway a moment later, she told him they had to go to the emergency room. A few hours later, Dr. Ann Brogdon walked down the hallway of her Boston area pediatric hospital. She could hear her new patient screaming from inside the small examination room. And when she walked inside, she saw the patient's parents, Emily and Dave, who told Dr. Brogdon that their son, Tommy, had basically been crying nonstop for days. Dr. Brogdon went straight to work. She knew that Emily and Dave were new parents, and so she really wanted to put them at ease, because Dr. Brogdon assumed this was just, child fussiness. So she gave Tommy a routine physical examination, checking his reflexes and taking his vitals. And as she gently poked and prodded him, she asked Emily about his medical history. And everything Emily said sounded typical and healthy. She told the doctor that she'd had a routine vaginal delivery after an equally normal pregnancy. Tommy had no known allergies, and he wasn't on any medications except for vitamin D supplements. He was also still wetting his diapers regularly, though his last bowel movement had been 2 days earlier. Tommy didn't have all of his immunizations just yet, so he was susceptible to pneumonia, influenza type B, and whooping cough, but Tommy's symptoms seemed more like a gastrointestinal problem than any of those diseases. And unfortunately, Dr. Brogdon's physical examination wasn't giving her any real clues either. And so she told Tommy's parents that she would just have to conduct a little bit more testing. An hour or so later, Dr. Brogdon looked at Tommy's test results on her tablet. Tommy had tested negative for a whole bunch of diseases, RSV, influenza types A and B, and even COVID. So his distress probably was not caused by a viral infection. Tommy's blood levels were also all normal, which ruled out other things like appendicitis, pancreatitis, liver disease, or some kind of obstruction in his digestive system. Dr. Brogdon's physical exam had also already ruled out the possibility of child abuse, and it was unlikely that a breastfeeding infant could have ingested poison. So what was going on here? Dr. Brogdon decided to ramp up her efforts. Something was obviously wrong with Tommy, and it couldn't just be a case of bad gas. So she ordered a urinalysis, an ultrasound of his abdomen, and an X-ray of his chest. She hoped one of those more advanced tests might finally solve the mystery around what was going on with Tommy. When Dr. Brogdon opened the door to Tommy's room an hour later, the sound of his wailing immediately filled the hallway. And inside the room, Emily was pacing back and forth with Tommy in her arms as his screams echoed off the walls. Emily and Dave looked utterly miserable, totally sleep-deprived and confused and nervous. And unfortunately, Dr. Brogdon didn't have anything really positive to say, which only made it that much harder to deliver the news. She still didn't know what was wrong with their son. His chest x-ray came back normal, his ultrasound and urinalysis were also normal, and yet he was still crying. Emily and Dave were heartbroken. They couldn't believe that nobody knew what to do here. But Dr. Brogdon promised them she was doing everything she could to help. And then she told Emily and Dave that she was going to admit Tommy to the hospital. Four hours later, one of the hospital's pediatricians, Dr. Christopher Reynolds, entered Tommy's hospital room. He'd read in the clinical notes that Tommy had been crying for days, so he was surprised to find that the room was actually silent when he walked in. Emily and Dave were inside the room sitting on the bed. Dave was holding Tommy, who was nearly asleep. After more than 6 hours of uninterrupted crying, it seemed like the little boy had finally tired himself out. Dr. Reynolds hoped that was a good sign. The doctor introduced himself and reached for the baby to do a physical exam. He'd already scanned Tommy's case file and knew that despite crying for days, Tommy was mentally alert. But when Dr. Reynolds took Tommy and fully woke him up and tried to get his attention, he noticed that Tommy did not seem to focus on him. At first, he wondered if maybe it was because the boy was just so sleepy, but the more he examined the child, the more he began to realize that Tommy seemed to have no energy at all, and his reflexes were quite slow. It was like his reactions were on a time delay. Dr. Reynolds knew Tommy had to be tired, but this was something else. Dr. Reynolds immediately ordered an MRI to see if there was something wrong with the child's internal organs. And fortunately, that scan showed no abnormalities, but it meant Dr. Reynolds had to order more testing to figure out what was actually going on here. He told Emily and Dave that he wanted to test Tommy's next stool sample. And in the meantime, he also wanted to perform a lumbar puncture or spinal tap just to make sure that Tommy was not suffering from an infection in his brain or spinal cord. The spinal tap procedure did not take very long, but Dr. Reynolds knew it was very difficult for Emily and Dave to watch. The doctor had placed Tommy in the fetal position on his side and then inserted a long needle into his spine to draw out the spinal fluid. And even though he had placed numbing cream on the injection site, Tommy's cries were still ear-splitting the instant the needle broke the skin. Thankfully, it was all over in just a few minutes. Once Dr. Reynolds had the spinal fluid sample, he sent it for testing right away. And this time, Dr. Reynolds did get a useful clue. The spinal fluid analysis showed an elevated protein count, which could mean Tommy's body was working overtime to fight off some kind of infection. But since they had already ruled out a lot of the more common infections, Dr. Reynolds was now worried that Tommy might have meningitis, or inflammation in the brain. Bacterial meningitis, especially in children, is extremely dangerous. It can cause long-term problems with seizures, brain damage. It can even be fatal. And so even though the doctor didn't know specifically what kind of infection the baby was fighting, what he did right away was just put Tommy on antibiotics to try to kill whatever bacteria was causing the infection. About an hour later, Dr. Reynolds checked in on Tommy to see if the antibiotics were kicking in. But as soon as he examined the little boy, he could see there was a big problem. Tommy was really struggling to breathe, and whenever he breathed in, it almost sounded like he was grunting. In fact, Tommy was fighting so hard for oxygen that Dr. Reynolds could see his ribcage straining against his skin with every breath. And there was a faint blue tint growing around Tommy's lips, which truly scared Dr. Reynolds because that meant the baby was not getting enough oxygen. And so he immediately put Tommy on supplemental oxygen and instructed the nurses to rush him to the intensive care unit. Moments later, the hospital's pediatric critical care specialist, Dr. Cassandra Pierce, examined Tommy in the pediatric ICU while his parents, Emily and Dave, stood by at the foot of his hospital crib. Dr. Pierce thought Tommy's cry was more weak and pained, and in fact, it sounded more like a snore than a wail, like it was taking everything out of him just to make a sound. To Dr. Pierce, that was a sign of an airway obstruction. So she turned Tommy onto his back, and when she did, she noticed his eyelids were drooping and his head sort of bobbed strangely up and down on his neck. Dr. Pierce knew she had to act quickly, and so she called for an intubation kit, and right away a nurse came back with one. Then Dr. Pierce took the hollow tube and slid it down Tommy's throat past his vocal cords, all the while Tommy was jerking in discomfort trying to pull away. But once the tube was all the way in and Tommy stopped thrashing, Dr. Pierce hooked it up to a ventilator, a machine that would now breathe for Tommy, so his body could rest and get the oxygen it desperately needed. But even as the child's chest began to rise and fall in a steadier pattern, Dr. Pierce knew Tommy's lungs were still at risk to collapse. But just then, the heart rate monitor by Tommy's bedside began beeping. Tommy's heart began beating much faster than normal. Then another monitor began going off, signaling that Tommy's blood pressure was rising too. It was like his entire body was panicking, even though he was lying there quietly. Thinking fast, Dr. Pierce turned to the nurse and asked her to start Tommy on continuous infusions of opioids and drugs called benzodiazepines, which would hopefully get his body to relax and relieve his pain until she could figure out what was going on. Also, Dr. Reynolds administered Tommy a sedative and lower-dose painkiller. An hour later, Dr. Reynolds was leaning over Tommy, testing his reflexes, and they remained very weak. In fact, overall, Tommy was just growing weaker by the minute. Further analysis had been conducted on Tommy's spinal fluid, and it had come back negative for meningitis. On the one hand, Dr. Reynolds and the rest of the medical team were relieved that the boy did not have meningitis. But on the other hand, at this point, they still just didn't have a diagnosis for Tommy, which was making caring for him nearly impossible. It's like in some ways just having a diagnosis, even a bad one, would sort of be an improvement. They'd at least have the ability to try to treat something. But without a diagnosis, they were just sort of left scratching their heads. Dr. Reynolds went back to Tommy's medical history and looked for anything that somebody might have missed. But there was nothing that stood out. The child had no neurological deficits, he had no swelling in his heart or lungs, there were no gastrointestinal issues or urinary issues. On paper, Tommy should be fine. And yet, he continued to get sicker. In fact, he was now developing something called hypotonia, or severe muscle weakness. Something was clearly slowly paralyzing Tommy. But when Dr. Reynolds reviewed Tommy's brain scan, it showed nothing abnormal, which meant that whatever was weakening his muscles probably wasn't affecting his brain or spinal cord. Now, Dr. Reynolds knew he could diagnose Tommy with something called spinal muscular atrophy, a degenerative motor neuron disease that weakens the muscles closest to the center of the body. That would explain Tommy's overall weakness, his drooping eyelids, and his inability to latch when his mother tried to breastfeed him. It was also one of the more common genetic disorders in young kids. But deep down, Dr. Reynolds knew that diagnosis did not explain all of Tommy's symptoms, including the high protein levels in Tommy's spinal cord fluid. Then he thought Tommy's high protein levels and growing muscle weakness could be a sign of Guillain-Barré syndrome, a condition caused when the immune system attacks the nervous system and weakens the muscles. But Dr. Reynolds knew that that syndrome was very rare in babies. Dr. Reynolds paced the hallway outside of Tommy's room, trying to think if there was anything he hadn't thought of or some question he hadn't asked. And then he realized there actually was one question he had not personally asked the parents yet. And so he dashed back down the hallway to Tommy's room, he went inside, and he asked Emily and Dave, who were at their son's bedside, what had they fed their son in the past few weeks. Now, keep in mind, Tommy was breastfed, and so the assumption was he only got milk. But Dr. Reynolds was wondering if maybe this child had eaten something other than milk. But Emily looked up at Dr. Reynolds and just told the doctor that, yeah, Tommy is breastfed and he's only had her milk. Dr. Reynolds felt defeated. For a second, he felt like maybe he had just solved what Tommy's issues were. Maybe it was coming from eating something that was not his mother's milk. However, just then, Tommy's father, Dave, added that on occasion, when Tommy would not take his pacifier, they would sweeten it with a drop of honey. Suddenly, it all made sense, and Dr. Reynolds knew what was wrong with Tommy. But it was a terrible diagnosis, and there was no time to waste. Tommy needed emergency treatment right away, even before the diagnosis was confirmed. The second Dave had said they fed their baby honey on occasion, Dr. Reynolds realized that Tommy had something called botulism. Botulism is a rare but serious illness caused by a bacterial toxin that attacks the nervous system. As the disease progresses, it causes difficulty breathing, muscle paralysis, and sometimes even death. Adults can typically fight off botulism, but babies, like Tommy, are not capable of overcoming the bacteria that spreads it. About 90% of untreated infant botulism cases are fatal. While botulism is rare, the bacteria that causes it is not. In fact, it's found in many kitchens, often hiding in an unlikely place: honey. Honey is a natural sweetener, but it should never be given to babies under the age of 1 for this reason. Unfortunately, Dave and Emily didn't know this, and when they dipped Tommy's pacifier in honey to sweeten it, they had unknowingly made their baby very sick. Dr. Reynolds sent Tommy's stool sample out for testing, knowing that it would take 6 days for the results to come back. But he was so sure about the botulism diagnosis that he just started Tommy on a special antitoxin treatment right away. Over the next 10 days, Tommy slowly regained movement in his arms and legs, and his botulism diagnosis was confirmed. It would still take another 20 days or so before he was well enough to be discharged from the hospital, and then once he was discharged, he had to spend 8 more days at a rehab facility. However, at the end of it all, he would make a full recovery, and he is doing well today. On a Saturday afternoon in February of 2011, 18-year-old Michael Peary was 1,000 feet underground, crouched inside of a dark cave in Lafayette, Georgia, along with 4 of his friends. As Michael looked around, his headlamp beam bounced off all the low-hanging rocks and underground waterfalls and deep crevices, and it all just kind of felt like some kind of dark and otherworldly planet down here. So this cave that they were in was a famous cave called Ellison, and Michael and his friends had driven over 400 miles from their college town in Gainesville to see it. Ellison was almost 12 miles of tunnels and shafts and crevices, and thousands of cavers went through it every year. It was very popular. Now, to be clear, caving as an activity was not really Michael's thing. He was a marketing major at the University of Florida, and he mostly considered himself to be a pretty quiet person and liked studying or playing in his school band or volunteering with his church youth group. And so crawling through a tiny, pitch-black, very claustrophobic hole hundreds of feet underground was not really his first choice for fun. But Michael was not there today for fun. He was there because his close friend, a guy named Grant Lockenbach, had suggested it. So he had said, okay, I'll go with you. Just now, Michael looked over to where Grant was sitting with his girlfriend, whose name was Carrie, and also they were sitting with 2 of their other friends. And the group of them were all looking through a backpack and sort of taking stock of the various pieces of gear that they had brought along with them. Now, they'd only entered Ellison just a few minutes ago, but already the group had stopped because there was something in this area that Grant really wanted to see. And when Grant wanted to do something, it usually happened. Hence why Michael capitulated and wound up in this cave, because Grant wanted him to. And so, like normal, he went along with it. So Grant, he was the president of their school's Fellowship of Christian Athletes, which Michael, Carrie, and the other 2 friends were also members of. And when Michael had joined the fellowship, Grant had sort of taken him under his wing and told Michael that he had tons of potential. In fact, he said Michael had enough potential to be the next president of the fellowship. And this had given Michael a ton of confidence because he really looked up to Grant. I mean, a lot of people did. Grant was just cool. He was a few years older than Michael and was basically like a 6-foot-tall ball of positive energy who was always looking for some adventure to go off and do. Grant had been exploring caves as a hobby for the last 3 years, and he was actually really the only member of their group with any real caving experience. And it was actually this lack of experience amongst the other people that were with Grant, including Michael, that was the reason they were going through an easier tunnel within Ellison that was basically a straight shot through the mountain and did not require much gear like rope or climbing equipment. It was like very beginner. But despite that, despite the low level of difficulty of the caving route they had chosen, They'd brought that stuff anyway, all that extra equipment, because along this easier route, at the place where they were now stopped, was the entrance to a vertical shaft that Grant specifically wanted to climb down, even if he went alone. This shaft was 125 feet deep. So think of like a 10-story building. That is how deep this pit went. But it was actually called the warm-up pit because compared to the other, deep pits in Ellison, it was nothing. Some were way deeper, like over 500 feet. So this was definitely not beginner. This was an advanced thing to be doing, so Grant was going to do it. But again, it's sort of a novice level, more advanced thing to be doing in this cave. Now, Michael watched Grant take the backpack with all the equipment in it over to this pit's entrance, which was basically just a very large hole in the ground that was over near this waterfall, and it was only about a few feet away from Michael. And so Michael walked over to Grant to help set him up, which involved attaching a climbing rope to the rocks that Grant could then use to lower himself into this pit with. This process is called rigging, and it took them a while since really Michael had to wait for Grant to instruct him on every step, because Michael, again, is not an experienced caver at all. But as Michael worked with Grant to get him all rigged up, he found himself peering into the pitch black hole, and as he looked down into what just felt like this bottomless abyss, he felt his stomach kind of flip. He was glad he had not promised Grant that he would go into the pit too, because, seeing it now up close in person, this was terrifying. He did not want to go into this thing. But Grant clearly did. He was excited. And so Michael and Grant continued to get Grant all set up, and then eventually, finally, when Grant was rigged, Michael heard the sound of something pretty heavy sliding off of a rock, and then moments later there was this loud, echoing thud from deep inside of this hole, the warm-up pit. For a moment, Michael was just confused. He didn't know what the sound was. Maybe it was a rock falling into the pit, but he looked over at Grant, and Grant had a very unhappy expression, and he was looking at the ground right next to the pit hole, and that was where their backpack had been, with all the equipment inside of it, at least the equipment that they weren't using, and the backpack was not there anymore. The backpack had just fallen 125 feet down into this pit. Now, obviously, this was not good. They did not want their backpack in this hole, but it was actually worse than just losing their equipment potentially, because in that bag was their only cell phone that they had brought with them. And it was also where they had put all their ropes and other climbing gear. They'd taken some stuff out, to get Grant rigged up here, but still, losing this bag felt really bad. Without its contents, they could easily get stranded or trapped inside of this cave, and they wouldn't be able to call or text anybody. They'd be stuck. And so Michael could actually feel himself starting to panic, but then Grant cut in and played it cool as always, and he said, look, it's no big deal. He would just go down there and he would get it. He was going into the hole anyway, and he was rigged up after all, so he would just go down and retrieve the bag. It would be fine. And then before Michael or, Grant's girlfriend or the other friends could say anything, Grant just, strapped on his harness and a pair of ascenders, which were climbing tools that would help him move down the rope in a controlled way, and he began sort of positioning himself to go down into this pit. And Michael just watched Grant in complete awe. Grant was so confident that he was able to basically make everybody else around him feel calm too. And Michael felt himself calming down just watching Grant. And this was not the only time that Grant had projected calm in the face of danger. During Grant's freshman year, he'd casually climbed up the exterior of one of their school's dormitories just to see if he could do it. And he did do it. And he also had joined the school's ROTC, which is a military reserve training program, and learned how to jump out of planes. So he had skydived, sort of a thrill-seeking activity. And so this moment in the cave seemed like yet another example of why Grant was really such an incredible leader. And Michael found himself hoping that by the time he potentially took over as president of the fellowship, that he could be just as fearless as Grant. But for now, Michael watched as Grant very calmly lowered himself into the hole and then disappeared into the abyss below. And for the next few minutes, it was very quiet. And all Michael could hear was the sound of the waterfall. So he and Carrie and the others just sort of talked amongst themselves and waited for Grant to call back up that he was down there and had successfully grabbed the backpack. And finally, they did hear Grant, and he did call out from somewhere down in the hole. But Michael couldn't really understand what Grant was saying because the waterfall that was kind of blasting nearby was really loud, and also Grant's voice echoed around the cave, which made it hard to tell what he was saying. So at this point, Michael and Carrie and the others were not worried. They figured that this was just an acoustics problem, not a safety problem. So Michael just walked over to the edge of this pit and kind of leaned over
and just looked down. But, he couldn't see Grant. He was too far down and it was too dark. And so Michael called out, asking Grant to repeat himself because they couldn't understand what he was saying. And Grant did yell back. He clearly replied to Michael, but Michael still couldn't really make out what he was saying. However, this time, there was something really different about the way Grant sounded. Again, even though he doesn't know what Grant's saying, one thing was definitely clear. Grant no longer sounded like the calm, cool, and collected, fearless leader that he normally was. He was talking really fast, he was repeating himself, he was saying something really, really quickly, very urgently. And even though, again, it wasn't clear what it was, the tone was very clear. Grant was scared. There was a problem. Now, obviously, problems arise when you are rappelling into a 125-foot hole underground in this cave. That, problems can happen. But for Michael and the others, when they sort of realized that something was wrong for Grant, it was really shocking. I mean, Grant is the guy that got other people out of problems. He was the calm guy. Nothing rattled him. And so just to hear him basically panicking, it was really unsettling for those at the surface. And so Michael and the others, they're kind of hit with this sudden realization that, one, it's very unsettling to hear Grant sounding this way, but worse, two, is they're not cavers. They can't go into this pit and save Grant if he needs saving. Not only because they lacked experience, but also all the caving, all the climbing equipment was in that backpack that fell into the pit that's down there with Grant. So there's no way they can realistically help him if he is in any sort of trouble down there. And also, their one cell phone is down in that backpack in the pit. And so unless Grant can figure out whatever problem he's got and get back up here on his own, Michael and the others, without even saying it, knew like they were kind of helpless. And so as this realization is setting in for Michael and the others, Grant goes from trying to talk to them, even though, again, they can't tell what he's saying, he just sounds sort of panicked, to straight up screaming. He's screaming for them. Something is horribly wrong. And so Michael and Carrie, they start yelling down to Grant, trying to get him to clarify what's going on, but you have this waterfall that's causing all this noise and splashing everywhere. It's dark, and Grant clearly is so panicked that he's not even listening to them, and so it's chaos, it's madness. And so Michael and Carrie, they turn to the other two friends, and they say, look, we're gonna stay here at this hole and wait for Grant. You two leave the cave, go get help. And so the other two, they rushed off to do just that, while Michael and Carrie just sat there listening to Grant getting more and more hysterical by the second, somewhere down in this hole. They still have no idea what's wrong, but clearly there is an emergency here. And so for a little while, after the friends have gone off, Michael and Carrie, even though they're not really talking to Grant because he's just kind of rambling and yelling and screaming, they can't understand him, they're just kind of shouting down into the hole that everything's going to be okay. We've sent to get help. It's going to be okay. You're going to get out of here soon. They have no idea if he can hear them or understand them. They're assuming that the acoustics are bad down there too. Again, the sound of that waterfall is so loud. It's so dark. And so they're just like having this awful moment. But then what cut through all this chaos was at some point, Michael heard Grant say something that he really did understand. Grant, at some point, in a very high-pitched, almost screaming voice, yelled out Michael's name. Like he was directly yelling to Michael, like, I need you, Michael, to help me. Now, at this point, obviously the situation has escalated dramatically and already, like, things are bad. And for Michael, this felt like a big deal. Before that, all the yelling and screaming was obviously bad. But Michael, he kind of views himself as, Grant's successor, potentially. He's going to be the next, president of this fellowship. And he looked up to Grant so much, primarily because Grant was like this fearless leader. And so Michael sort of felt like when he heard his name called out, that Grant was specifically sort of challenging him, like, you, Michael, I need you. Michael took on that responsibility. And he felt like, I can't just sit here. I can't just wait. Something needs to be done, and I need to do it. I need to save Grant. And so Michael, he jumped up, and he grabbed the extra harness they still had, and he put it on. And as he was doing that, he could hear Carrie, who, she's seeing what's happening, and she's telling him, don't do it. You don't know what you're doing. You don't know how to go down this thing. Like, this is dangerous. Or what are you doing? Don't go. And Michael, he just looked at her and he said, I have to do this. I know Grant would do this for me. I'm doing it for him. He needs me. I'm going down. And Michael, he's listening to Carrie, still trying to tell him not to go, but he just said to her, please pray for me. And then he walked over and he attached his harness to the same rope that Grant presumably was still attached to down at the bottom, but stuck for some reason, and into the pit he went. As soon as Michael disappeared into this hole, Carrie knelt down beside the pit, she put her hands together, and she prayed as hard as she could for Michael and Grant to be okay. And after a few minutes, she heard Michael call out from somewhere in the hole. And for some reason, she could actually understand what Michael was saying, which was basically that he and Grant were okay, he was with Grant, but they were just very, very cold. Relief flooded over Carrie, and as she exhaled all the tension she'd been holding in, and as the adrenaline kind of began to leave her body, because now she's thinking everything's okay, she also realized that she too was very cold. She just hadn't been thinking about it. She was so fixated on the safety of her boyfriend and also Michael. After all, she was only wearing a t-shirt, and the cave was very damp, and there's this waterfall kind of spraying water everywhere. It was cold. It was a damp environment. And so she's, her teeth are chattering too. She's cold. And so Carrie naturally yelled down into this hole. She can't see them, of course. She's just yelling into the darkness. What's going on? What's wrong? Is Grant okay? But Michael just shouted back to her, I'm fine, but didn't answer her question about Grant. And at this, Carrie could tell clearly there's something really wrong down there, and it probably has to do with Grant. And so she stood up, she began pacing back and forth, her stomach's in knots, and she's periodically yelling down into the hole to Michael, like, what's going on? Is Grant okay? Are you okay? But Michael, all he would say back to her is, I'm fine. He would just say that back to her, but his response time began to slow down. He wasn't responding to each and every one of her calls. He would just, yell out, I'm fine, but it began to become more and more spaced out as Carrie began to ramp up her questioning, asking more and more what's going on, until finally Michael just stopped answering altogether. There were no more voices coming out of the hole. And so the minutes ticked by, and Carrie, she continued to pace around, yelling out to Michael and Grant, but the only reply she got was the sound of the water from the waterfall lapping up against the cave walls. About an hour and a half later, just before 4 p.m., a man named Anmar Mirza, along with 2 other men, ran into the Ellison Cave with a bag of climbing equipment and medical supplies. Now, there was a bigger team of rescue workers on their way up the mountain behind them that had more gear and more personnel, but that group was moving slowly because it took time to respond to a cave accident, because typically there were a lot of people and a lot of equipment, specialized equipment that was required, and also usually the victims were trapped in, pretty remote and difficult to access places, like tunnels and shafts deep inside of these caves. So Anmar and his team were the initial smaller group that went ahead of the larger one to just kind of get the rescue started. A few minutes after entering the cave, Anmar saw a headlamp beam up ahead in the darkness, kind of bobbing around. And as soon as he reached the origin of this light, he found a young woman who was sitting by a large hole, and she was shaking and terrified. She explained that her name was Carrie, and that her boyfriend, whose name was Grant, along with one of his friends, whose name was Michael, were down in this hole, and that Grant had gone in, there had been some issue, Michael had gone in after him, and now, when she called out for them, neither of them were responding. After hearing this, Anmar directed one of his team members to take Carrie and bring her out of the cave, and then once they had left, Anmar put on his climbing gear, and as soon as he was ready, he began to rappel down into this pit. As Anmar rappelled, he's looking straight down into this dark shaft, and at first he can't see anything. But after a little while, he began to see somewhere down below were what appeared to be 2 lights towards the bottom of this pit, which he assumed belonged to the 2 men. But before he could actually reach them, he felt something wet and freezing cold splash his cheek. Then he saw something emerge out of the darkness right below him. It would turn out, when Grant rappelled down into this warm-up pit, he had made a terrible, terrible mistake. He had attached his rig to a section of rock that was directly in the path of a freezing cold waterfall. Now, this alone could have been okay. You can rappel effectively through a waterfall if you're careful. Except what happened with Grant is, as he was rappelling literally through the water, like the water is coming off this waterfall, it's hitting him, he got stuck. His rope got tangled. And where he got stuck was literally in the path of the waterfall. So he's stuck in the cave, he can't go up, he can't go down, and he's just getting pounded by freezing cold water. Now, at first, what Grant likely did is kind of flail around to try to get out of the path of this water, but there was nowhere to go. He's in this shaft, there's nowhere to go, and he's just dangling there, and he began trying to scream out for help, but that was why his his words were muffled because the water was hitting him in the face, so he couldn't speak clearly. And then also, as he's just dangling there very quickly, having that icy water hitting him nonstop would have actually sent his body into shock. And it's like he wouldn't have been able to speak or think anymore. I mean, he was becoming hypothermic. And then, in what was possibly one of his final moments of clarity, he managed to belt out Michael's name. And he said it really clearly, kind of managed to get his face out of the water for a second. And Michael, who trusted Grant completely when he heard his name being called, it felt like it was his calling. He needed to go in there and save Grant himself. And so into the hole he went, and he hooked his rope up into the same exact spot that Grant had, and down he went. And Michael, he did an incredibly brave thing by doing this. And it was something that Grant very likely would have done for him too. But again, Michael really had no idea what he was doing. He was basically just going in blind. However, unfortunately, because he just kind of followed Grant's lead and went down there without a plan, well, in the darkness, as he went down, he eventually reached where Grant was, but got stuck as well, also in the path of the waterfall. Granted, he was not nearly as exposed to the water as Grant was, like his face was not getting blasted by water, so he was able to call out and be heard by Carrie, but he also got tangled at the same spot, couldn't move, his body's getting hit by this icy water, and so even though the rescuers did eventually get down to Michael and Grant, by the time they did, it was too late. The two men had froze to death. They basically dangled inside of this hole, getting hit by this water for about 2 hours before their bodies just shut down. In 2013, 2 years after both Michael and Grant died inside of that cave, the Carnegie Hero Fund Commission gave Michael a posthumous medal for risking his life to save Grant's.
Our next story is called Not Going Anywhere.
On a Friday night in late March of 1980, an 83-year-old man named Harry R. Truman sat on his couch in his Washington State Lodge with a whiskey and Coke and turned on his battery-operated radio to listen to the news. And just a second or two later, he found himself having to jack up the volume of the radio because he couldn't hear it anymore because a couple of his cats in the other room were fighting and yowling and it was causing a whole commotion. Harry had lost track of how many cats he actually had, but it was a lot, maybe a dozen. And even though at this moment he yelled and cursed at them and told them to knock it off, he was actually glad they were out there with him because he liked their company. 5 years earlier, Harry's wife, Edna, had died. And since then, he had lived alone, minus all these cats. And he also didn't have a lot of neighbors either, so for the most part, he had been fairly isolated the last few years. Also, Spirit Lake, the lake that his lodge was on, was 4 hours south of the major city of Seattle and pretty far into the wilderness. The lake did get busy in the summer with tourists, but at this time in March, there were only about 60 people that lived there, and they were very spread out. But Harry didn't really mind the solitude. He missed Edna a lot, but he had his cats, and he had his radio, and the jaw-dropping mountain scenery and lake, and he had his whiskey and Cokes. So overall, even though he was sort of a gruff guy, he was actually quite happy with his life. But just then, there was a loud knock on Harry's door. And Harry was not surprised by this. I mean, yes, he lives way out in the middle of nowhere, and he did not expect visitors, but in this case, he knew who it was. And as soon as he thought about that, his face contorted into a scowl. He was really annoyed. At this point in Harry's life, he really had only one problem. And it was a major problem, at least to him. And that was the government. And for the last few days, government agents, like almost certainly the ones that were knocking on his door, had been harassing him, trying to get him to leave his lodge in the wilderness that he loves so much, because they needed to conduct some kind of federal operation and they wanted everybody to clear out. Now, Harry loved his country and he'd even fought for it during the First World War, but he really did not like authority and he could not tolerate being told what to do. During Prohibition, for example, which was a period of time in the 1920s when alcohol was illegal in America, Harry had simply ignored the law and made his own booze, like he just didn't care. So, over these last few days that these federal agents had come to his house trying to get him to leave, Harry had not been intimidated, he had simply stood his ground. And he figured it was really only a matter of time before the federal government sent a local police officer over in hopes that Harry would be more cooperative with somebody that he likely already knew. But what they didn't know about Harry is that Harry really didn't cooperate with anybody. Not with the government, certainly, not with local police, Not with his own family, not with his friends, or not with the two ex-wives he'd been with before finding Edna. He was just somebody who marched to the beat of his own drum. So now, Harry did not get up to answer the knock at his door. Instead, he just waited until the person out there, the visitor, yelled through the door and announced who they were, and not really to Harry's surprise, it was the local deputy that Harry did know, clearly being sent here by the federal agents to try to get Harry to leave. And when Harry still didn't answer the door when the deputy clearly had announced themselves, knowing Harry would know who they were, when Harry still didn't get up, didn't answer the door, the deputy finally, just sort of frustrated, called out, "Harry, are you sure you don't want to go?" Now, even though this deputy was being a whole lot more amicable than the government agents had been, they had been really forceful, basically telling him you gotta leave, the deputy here was at least kind of giving Harry a chance to make a decision. Despite that, the question the deputy had asked just made Harry really mad, because leaving his house was just not something he would ever consider doing. Harry had lived in this lodge for 54 years, and 37 of those years were spent running this lodge as an inn, as a business, with his late wife Edna, who was the love of his life. Now, he'd let the lodge go a little after she had died, so truthfully it was kind of falling apart and it smelled terrible, because of all the cats, but it had been theirs, and now it was his, and he would never give it up. And not only that, but just outside his doorstep was Spirit Lake, which Harry believed was the most beautiful, perfect place in the entire world. It was quiet and serene and situated right at the base of some of the most breathtaking mountains he had ever seen in his whole life. And so to say Harry loved it here was a complete understatement. His lodge and Spirit Lake were basically his whole identity. Harry didn't know if he believed in God, but he did believe in the trees and the lake and the birds that screeched at him at all hours of the day. It was like his home, this area, was his religion, and he certainly was not about to give it up just because some federal authority or government agent or whoever told him to. So all Harry said to the deputy waiting outside was a very firm "good night," which Harry was actually quite proud of himself for because he had a really hard time not swearing. So this seemed pretty mild. After that, Harry waited to see if the deputy would challenge him or say anything else, but he didn't. And moments later, Harry heard the deputy's footsteps crunching down the gravel driveway and heading back towards his cruiser. After that, Harry leaned back into his couch and smiled to himself and picked up his drink, kind of toasting himself for standing his ground, and at the same time sort of hoping that maybe now, finally, officials would understand that he was not going to change his mind. But that's not what happened. A little more than a week later, on the morning of April 5th, Harry sat in a folding chair in a clearing by his house with his binoculars pressed to his eyes and a glass of whiskey in the cup holder of his chair. This was an area of the woods near his house he called his cocktail lounge, where he'd often go to relax with a drink. It was covered by a thick canopy of evergreens, but it also had a great view of the mountains and also the lake. But Harry was not here to relax. He was actually on very high alert because the woods were absolutely crawling with federal agents and local law enforcement officers. Harry could literally see them right now through his binoculars, walking around the various camps they had set up all over the mountainside and also near the lake. And there was nobody to stop them because everybody else who lived in this forest had bowed to the pressure and left when told to, which meant Harry was quite literally the last resident still fighting the good fight. Now, so far, officials had not physically attempted to force him out, but now that Harry saw them assembling all over the mountainside, he had to wonder how long he had before they did try. But at the same time, he also knew that he had one piece of very important and very surprising leverage over the authorities, and that was that over the past couple of days, Harry's refusal to leave his wilderness home just because the government told him to had turned him into a media attraction. Reporters had heard about what was going on and they'd started coming to his house. Now, usually, Harry just did not like the press. Even though he clearly listened to the news himself, he still thought of the press, thought of the media like they were vultures, always looking for dead meat and chaos. But Harry also really liked to talk, and he had a lot of very strong opinions. And now, seeing his beautiful lake inundated by outsiders, Harry realized he had to take full advantage of this media interest in him if he wanted to stay in his home. Because the way he saw it was the government could really not make him do anything against his will if the whole world was watching. So over the next month, Harry gave a lot of interviews. And pretty quickly, he became kind of an international celebrity. He was this single older man standing up to something way bigger and way more powerful, which was sort of admirable, although people didn't really understand it, but it was still a big story. It was very interesting. But more than that, it seemed like the public just sort of liked Harry. In his interviews, Harry would swear and yell and rant and rave and tell reporters about how no authority figure would dare try to get him out of his house.
No, I'm not going to leave. Damn right I'm not going to leave. I'm going to stay here. Damn right, this is my home. It's going to have to come and get me. And no authority can take me out of here. No authority dare.
And he'd also talk about his life, just telling these crazy stories that had nothing to do with the wilderness, like about the whiskey that he'd bottled and distilled during his Prohibition days, which he called Panther Pea, and about his relationship with his late wife and how they used to dance together at the edge of the lake, or his war stories from World War I. I mean, this guy was just really quite fascinating. And so by the time May rolled around that year, Harry went from being bombarded by the government to being bombarded by the media. Today, this would be like going crazy viral, where everybody's seeing you on their feed. But this is 1980, and so people got their news from newspapers and the television and the radio. But those mediums were all full of Harry, and people were kind of obsessed. Everybody from average citizens to school kids sent Harry fan mail, and reporters and news crews came to Harry's in droves, and some even took helicopters just to get there more quickly. And Harry, if he was being honest, he sort of relished all the attention. A few months earlier, he'd been happy with his quiet life, no phone, and he just had his 1,000 cats for company. But now, it's like the whole world cared about him, and it was pretty cool. A few weeks later, though, everything changed. On Sunday, May 18th, the sun came up on Harry's lodge, and the woods around it were totally quiet for the first time in weeks, because Harry, in some ways, had won. He had kept his word, and he'd stayed strong and refused to give in to the government's demands to leave. And finally, the government had backed down. And the sheriff had even come by the day before to tell Harry that, okay, no one's going to come by and ask you to leave anymore. It's on you. And so now, on May 18th, as Harry was getting up, it was just him, the lake, the trees, and the big, beautiful mountain. And then, at 8:32 a.m. that morning, a deafening boom shook the earth. It would turn out the media was not totally finished with the story of Harry R. Truman. In fact, what happened on the morning of May 18th, 1980, would in many ways make Harry even more famous than he already was. Because Harry didn't live at the base of just any old mountain. His lodge was situated directly at the foot of Mount St. Helens, which was an active volcano. The government operation that the federal agents and local law enforcement were trying to run here was an evacuation. They were not trying to impede on Harry's rights. They were trying to save him. But Harry was so convinced that the land he loved so much, that he had lived on for nearly 60 years, would not hurt him. And so he ignored the authorities' repeated warnings. But Harry's decision was the wrong one. And on May 18th, he paid for his mistake. Because that morning, Mount St. Helens erupted, sending an avalanche of searing lava and mud directly onto Spirit Lake and Harry's lodge, killing him and his cats instantly. His remains were never found. 57 people died during this eruption, including Harry. Today, in that area, Harry has both a trail and a ridge that are named after him. So in a way, he remains a part of the mountain that he loves so much.
On August 25th, 2010, a small twin-engine propeller plane sat on the tarmac at Kinshasa International Airport in the Congo. As the plane was being refueled, the co-pilots, 62-year-old Danny Philomot from Belgium and 39-year-old Chris Wilson from England, walked up the stairs and into the cockpit. As the pilots got settled in and began their internal systems checks, the flight attendant walked up the stairs. She said hello to the pilots, and then she began preparing the cabin for the passengers. The main cabin began boarding at 11 a.m., and by 11:30 a.m., all 18 passengers that were expected to board had taken their seats. So the flight attendant closed the doors, went into the cockpit, and told the pilots they were ready for takeoff. This was going to be a 1-hour-long routine domestic flight to Bandundu, which is a province that was just outside the border of Kinshasa to the east. This particular crew had made this flight dozens of times in the past without any issues. As the little plane made its way over to the runway, the flight attendant demonstrated what to do in case of various in-flight emergencies, and then by noon, the plane was airborne. 1 hour later, residents of a town located just southwest of Bandundu remembered looking up into the sky and seeing the small prop plane falling through the clouds in a near vertical nosedive. Seconds later, the plane crashed into the ground right in the middle of the neighborhood. Luckily, the crash did not kill anybody on the ground, but unfortunately, the pilots, the flight attendant, and 17 of the 18 passengers died on impact. And the one passenger that survived was very badly hurt and was left in a coma. An investigation was launched into what happened, and very quickly it was theorized that they must have run out of gas, because when they hit the ground, there was no explosion, there was no fire, but upon closer inspection, it would turn out the plane had plenty of fuel. The black box, which is a device that records the audio inside the cockpit, was recovered, but unfortunately it was inoperable, so it didn't give them any other clues as to what happened. Investigators were stumped. Did they strike a bird in the air? Did the engines suddenly fail? Was it operator error? They didn't know. A few days after the crash, the one surviving passenger miraculously came out of their coma and remembered in vivid detail what happened up in the skies right before they crashed. They said as the plane was making their final descent into Bandundu, the flight attendant was walking down the aisle reminding everyone to put away their big devices and put their seat in the upright position, and as she got about halfway down the aisle, she looked towards the back of the plane and she suddenly gasped and covered her mouth, turned around and walked very quickly back towards the front of the plane into the cockpit where she disappeared. The passengers that had seen her do this were immediately concerned that something was wrong with the plane, and so they stood up and looked towards the rear of the plane where she had been looking, and right away they knew what it was she was concerned about. There was a hissing crocodile making its way up the aisle. Someone must have smuggled it on. And as passengers realized what was happening, they all panicked and stampeded towards the front of the plane. This sudden shift in weight threw off the plane's center of gravity, causing a nosedive that the pilots could not recover from before they crashed. After hearing this story, the investigators remembered that a living crocodile had been found around the wreckage, but no one had thought much of it because in the Congo, lots of exotic animals are smuggled onto flights. Specifically, crocodiles are smuggled onto these planes with such regularity that passengers often can recognize the very specific crocodile smell somewhere in the cabin. And they'll tell the pilots, they'll come back, they'll find the crocodile and the owner of said crocodile. They'll kick them off before takeoff. But obviously this time, nobody smelled the crocodile. Just after midnight on April 4th, 2013, a man stepped out of his tent into the pitch black woods of central Maine. He was wearing a wool hat, he had a nice brand new Columbia jacket on, some Land's End jeans, and some high quality boots. He was carrying a backpack as well as another bag that contained a screwdriver along with some other tools. He adjusted his glasses and then looked up into the sky, and it was so dark he couldn't even see the moon, and he thought to himself, perfect. He turned and began quickly walking away from his tent into this forest where the trees were so dense that if you weren't careful, you could actually get stuck in between two trees. And scattered all over the ground were these huge slippery boulders covered in moss where one wrong step and you're breaking an ankle. But despite the rugged terrain and zero visibility, this man was able to easily navigate this area as if he had memorized every step. After an hour of silent hiking, he reached this huge pond called North Pond, and while staying hidden in the trees, he followed the shoreline until he reached the edge of the forest overlooking this clearing. And right in front of him were dozens of cabins overlooking this pond. This was Pine Tree Summer Camp. He waited in the tree line for a few minutes just listening to make sure nobody was out there, even though he knew their schedule and knew no one was there. After not hearing anything and feeling like the coast was clear, he stepped out of the woods and walked up to the top of the camp to the dining hall, and he made his way around to the back door. There, he pulled a screwdriver out of his bag and expertly popped open the lock and stepped inside. Once he was inside, he pulled out his tiny flashlight and he made his way over to the pantry where he began stuffing his bag full of candy, chips, and coffee. Once his bag was almost completely full, he walked over to the walk-in freezer, he went into his pocket and pulled out a key that he had stolen on a previous trip. He unlocked the lock, went inside, he grabbed some frozen hamburger patties and hot dogs, and then he left the freezer and locked it behind him. He did one more pass through the pantry and grabbed some more candy off the shelves and jammed them into his pockets, and then after feeling satisfied that he had all he could take, he decided it was time to leave. And so as he made his way to the door, he thought to himself, great, another successful raid complete. Or so he thought. A motion detector had recently been installed inside of the dining hall behind the ice machine. As soon as this man had pried open the back door, it had picked him up and remained silent, but sent an alarm to the nearby home of Sergeant Terry Hughes, who was a game warden that was investigating recent thefts in the area. Terry sped to the camp in under 4 minutes, and he parked his truck a ways away from the dining hall because he was worried he would scare off the perpetrator. So he parked his car and ran on foot, staying in the tree line until he got right behind the dining hall. He ran up to the back door and looked in the window, and he saw this tall, skinny man walking out of the walk-in freezer. And this guy did not look towards Terry. Instead, he turned and walked farther away from him over towards the pantry. This guy pulls a flashlight out, he shines it at one of the shelves, and he takes some things off the shelf and puts them in his pockets. And then after standing there for a minute, the man turns off his flashlight, faces Terry, and begins walking towards the back door. At this point, Terry backs off the window and goes behind a tree that's overlooking the back door. He gets his flashlight in one hand and he unholsters his pistol and he waits. Terry watched as this man barely opened the back door. He slinked out the crack and then he began walking into the woods. And at that point, Terry leapt out, shined the light in his face, drew his pistol, and told him to get on the ground. The man didn't resist. He immediately got on the ground, and Terry called the state police, who were there only a couple minutes later. They arrested this guy and put him on a chair, and then they began interviewing him. They asked him what his name was, and the man just remained silent. And so they searched him, but they couldn't find any form of identification, and so they asked him again, "What's your name?" And the guy again didn't say anything. So the officers decided to remove his handcuffs and give him a bottle of water and then see if he would talk. And sure enough, he did. His speech was slow and awkward and kind of abrupt, like he had not spoken in a really long time. He told them his name was Christopher Knight and that he had been born on December 7th, 1965. He said he didn't have an address, he didn't have a vehicle, and he had never filed a tax return. He told them he lived in a tent in the woods nearby. They asked him how long he had been doing that for, and he paused for a minute and then said, "When was the Chernobyl nuclear plant disaster?" And the officers looked at each other and they were like, 1986. And he's like, "Yeah, that's when I went in the woods." And they were like, "That was 27 years ago." And Chris said, "Yeah." The officers asked him, well, 27 years is a long time. You got to be out there with some other people. Is your family out here? You got a girlfriend? You got, some sort of companion out there with you? And Chris said, "No, I live out there alone." And in fact, the last time I had a conversation with another person besides now was in 1990 when I happened to walk past another hiker and we both just said hi to each other. Besides that, for 27 years, it's just been me. And it would turn out Chris wasn't kidding, and he went to great lengths to ensure he stayed completely cut off from the rest of society. Despite winter temperatures dropping to negative 20 degrees, he refused to light a fire in fear of giving away his camp. And so instead, when it got that cold, he would just stay up all night pacing around his camp, trying to stay warm that way. He never even talked to himself or sang out loud because he was so worried someone might hear him, and he never left his campsite unless it was basically pitch black on an overcast night because he was afraid of being seen. When the officers asked him if he had access to the internet at least, he said, I haven't seen the internet. Chris wound up confessing to over 1,000 burglaries over the 27 years he had been out in the woods. He said he was ashamed of it, but originally when he had moved out into the woods, he had tried to hunt for his own food and forage for his own food, but he was terrible at it, so he had to resort to theft. He said he only robbed cabins and homes when he was certain no one was there, which meant sometimes going a long period of time between meals. And the food he did find made for a terrible diet. He mostly ate junk food and candy because it was stuff that was easy to find and kept fairly well. When asked why he had moved into the woods in the first place, he didn't really have an answer. Although in a later interview, he would say that growing up, human interaction had always been very difficult for him, and when he was in the woods, he just felt kind of content and at peace. When Chris's story broke, the residents around North Pond were shocked. For decades, they had swapped stories about someone or something haunting the area. Propane tanks, food, batteries, clothes, books would all go missing. They were starting to get scared, especially when it was overcast at night, because they knew that was when this person would come out. But despite staying up at night with their weapons out, ready to confront whoever it was doing this, they never found him. And the police were repeatedly called to come in and try to solve this mystery, but they couldn't figure it out either. As the incidents mounted, the Phantom was given a name, the North Pond Hermit. When Chris was finally arrested and some of his life story was leaked to the media, residents of North Pond were torn on how to feel about him. Some people thought he was purely a criminal, that he was a thief, and that not only had he stolen their physical property, he had also stolen their peace of mind and their sanity. Others idolized him like he was some cult hero. He was a man that rejected what society says makes us happy: careers, relationships, material comforts. Yet he was happy. But regardless of how residents felt about his lifestyle, the one thing they could all agree on was how incredible it was that he survived for as long as he did. Winters in Maine are notoriously brutal and cold. A week of winter camping would be considered a huge accomplishment, let alone an entire season. That was totally unheard of, and Chris did entire seasons 27 years in a row. Ultimately, Chris was sentenced to 7 months in prison. When he was released, he was given 3 years of probation, and part of the conditions for his release is that every week he would have to go physically check in with the judge, which meant he would not be able to just escape back into the woods again. When his probation did finally end, he did not go running back into the woods. He decided to remain in society. In an interview, Christopher was asked what he learned from these 27 years in total isolation. What have you learned about the human experience? What did you learn about yourself? Tell us, because you have knowledge that virtually none of us will ever have access to. And apparently he just paused, thought about it for a second, and then looked up at the interviewer and said, "Make sure you get enough sleep." And then he got up and walked away. While we don't know exactly what Chris is up to these days, people that know him say he lives by himself in a small apartment, he has a regular job, and he values his privacy over everything else. One of the least known, most hazardous jobs on the planet is saturation diving. These highly specialized divers do construction and demolition at depths up to 2,000 feet below the surface. Now, unless you're familiar with diving, that depth may not stand out to you, but it should. Deep sea divers breathe compressed air, which is usually a mixture of oxygen, helium, and nitrogen. During the dive, the oxygen is breathed in and completely used up and does not linger inside of their body. But the helium and nitrogen, they are absorbed as they're breathed in into the bloodstream, and they remain there for the duration of the dive. As the diver ascends in the water column, the pressure on them from the water is reduced, which allows these two gases to clear out of their bloodstream. But they clear at different rates. Helium is considered a fast gas, which means you absorb it quickly and get rid of it quickly, but nitrogen is a little bit slower, and so it takes longer for it to absorb into your body, and then takes longer for it to clear out of your body. If a diver doesn't respect this and just rockets to the surface, any of the nitrogen or helium that did not diffuse out of their bodies will bubble up inside of them like a shaken soda, and it will wreak havoc on them, and many times it can be fatal. This condition is known as decompression sickness, or the bends. The way divers mitigate getting the bends is they have decompression stops in their dive, which means after they go down to a certain depth, on the way up, they will stop at a certain depth and just wait, and they will allow these gases to diffuse out of their bodies before making their way up to the surface. These decompression stops are planned and built into the dive beforehand. The deeper you go, the more frequent your decompression stops will be and the longer they will take. To give you a sense of just how long these decompression stops can be, if you dive down to just 250 feet, it might only take you about 15 or 20 minutes to get down there, but the return trip will take almost 4 hours due to the number of decompression stops. If you're going down to 2,000 feet, it will take you over 33 hours to ascend. Naturally, this ridiculous time constraint poses a huge problem for any industry that relies on deep sea work, like oil and gas, because they simply don't have enough divers to compensate for how long these decompression stops take. They tried sending remote-controlled vehicles down to these depths to work on these offshore wells and rigs and pipelines, but they lack the touch and maneuverability to do the job. And so, in the 1960s, a crazy solution was implemented to get more people down to these depths for longer periods of time. And it was then that the commercial saturation diver was born. Instead of divers spending hours and hours making all those stops on the way to the surface, they constructed these underwater chambers that the divers would go into after their shift was done. They would sleep inside of these claustrophobia-inducing metal chambers, and then the next day they would put their dive gear back on, hop outside of the chamber, and then just start working again. Nowadays, these chambers are either left down at depth where the diver is located, and they can just go in and out, and that's the whole process, or there's a dive bell that sits down near the work site, and the diver, when they're done, goes back into the dive bell. It kind of looks like an escape pod, and it's raised by a crane all the way up to the surface, where it's placed on top of a ship or a rig. And inside of this dive bell, the pressure is artificially made to match the depth they've been working at. And then when they're placed up on the surface on the ship or the rig, the bell is connected to a bigger chamber that's also set to the same pressure they're at down at depth. And they can go inside this chamber, they can sleep, they can eat, go to the bathroom, and then the next day the process is reversed where they go back into the dive bell, it lowers them down to depth, they hop out, and they continue their work. The point of this system is to keep divers fully saturated with their inert gases like nitrogen and helium so that they only have to do one major decompression at the very end of their shift, which is oftentimes multiple weeks long. Now, while the saturation diving system has worked extremely well, it's still extremely hazardous, which is part of the reason why it pays really, really well. Some divers have died because they panicked and got hurt. And if you think about what their job really entails, they are going down thousands of feet all on their own into total pitch black nothingness. They have one crummy light that can barely see about 10 feet in front of them. They're operating heavy, dangerous equipment. There are large animals swimming around them that they can't see. Oftentimes they're perched on a pipeline, clinging to it, that if they were to fall off of it and detach from the dive bell, they would sink into an abyss and no one could get them again. And so it's an easy place to get hurt. Other divers have died because they were given the wrong mixture of gas. And so at depth, they began having seizures, and there's nothing anyone can do to help them. But the most well-known and brutal saturation diving accident involved something called explosive decompression. On November 5th, 1983, 4 saturation divers were working off of the Byford Dolphin oil rig in the North Sea. Just after 4 a.m., 2 of the men, Edwin Coward and Roy Lucas, were in their bunks lounging inside of that chamber that sat up on the rig. The other 2 men, Bjorn Bergensen and Troels Hellevik, had just finished their shift down below. They had gone into the dive bell and were being raised by crane to go up to the chamber on the rig. Once the dive bell was up on the rig, 2 dive tenders named William Crammond and Martin Saunders began clamping the bell onto the side of the chamber. Without getting too into the weeds about how it actually works, getting divers to go from one highly pressurized area, the dive bell, into another highly pressurized area, the chamber, and vice versa, basically, it just boils down to opening doors at very specific times, and doing it wrong will result in catastrophe. The process was going just fine. Hellevik and Bergensen had exited the dive bell, they had gotten into the chamber, and they were literally in the process of shutting their internal door when outside, dive tender Crammond made a huge mistake. Before Hellevik had sealed his door, Crammond, for whatever reason, undid the latch that connected the dive bell to the chamber. And what this did is it created a vacuum that instantaneously depressurized the chamber where the 4 men were from 9 atmospheres down to 1, and it created so much pressure coming out of the chamber that it fired the dive bell straight out like a bullet, killing Crammond and severely injuring Saunders on the outside. Inside the chamber, all 4 men literally had the air ripped out of their chests. Hellevik, who was closest to the door, was literally sucked through the narrow crack because the door had not sealed. He was sucked through and rocketed out the other side. Basically, all 4 men exploded, but fortunately, they died instantly. So that's going to do. Born in South Texas in 1935, Roy Benavidez was orphaned as a young child and sent to live with his uncle. As a young teen, he had to drop out of school to work in the beet and cotton fields just to help support his family. When he turned 18, he decided he wanted to get away from his hometown and do something bigger with his life, and so he enlisted in the Army, and shortly after that, he went to airborne school and then was assigned to the very famous 82nd Airborne Division. In October of 1964, Roy was a part of the first 125,000 Americans sent to Vietnam. While on a classified operation that required Roy to dress up as an enemy combatant, he stepped on a landmine in the middle of the jungle and nobody else was with him, so he's totally stranded. But fortunately, a squad of US Marines came upon him, but from what he was wearing, they assumed he was an enemy soldier, and so they almost walked past him, but someone thought to just flip him over and see who he was, and they discovered he was American, and he had American dog tags on. And so he was evacuated from Vietnam and sent to an American hospital, and there, a doctor would tell him that he had a serious spinal injury and that it was unlikely he would ever walk again. And Roy's first reaction was, please don't discharge me from the Army. Because for Roy, the Army was his life. It was all he had. He was incredibly proud of it. And he desperately wanted to go back to Vietnam. And so he pleaded with the doctors and the nurses, please let me have some time to try to regain my strength in my legs so that I don't get medically discharged. And so they said, look, you're gonna get medically retired if you aren't walking within the year. And so every night when his doctors and nurses would leave, he would fall out of his bed and then drag himself across the ground to the wall, and then he'd pull himself up and try to put weight on his legs and attempt to build strength back up and retrain himself how to walk. And after 6 months of doing this every night, he did literally reteach himself how to walk. He built up strength in his legs, and his doctors and nurses, they're watching this transformation during the day, but they're not seeing him at night, and they're telling him, this is a miracle, we've never seen this before, we've never seen someone recover so quickly. And Roy just stayed quiet because he wanted to make sure he was allowed to keep doing that every night. And so finally, after those 6 months, his doctors and nurses agreed that, yep, he's good, he can stay in the Army. But the Army said they wanted him to take a desk job because he had already been so badly wounded in combat. And Roy didn't want that. He pleaded with them to let him go back to the 82nd, but they said, no, we're not going to risk you getting hurt again. And so he was sent to North Carolina for his desk job, and as soon as he got there, he began training like a maniac every minute of every day, trying to get in the best shape of his life, because his plan in his head was once he got there, he would try out for Special Forces. He would try to become an Army Green Beret, which is the premier combat unit in the Army. It's one of the hardest ones to get into, and their training program is in North Carolina. And so after a few months, he was in amazing shape, and he asked his superiors, can I go try out to be a Green Beret? And they're like, I can't believe you're even walking, but you know what? You've come this far, you can go try out. And just a couple of months later, Roy Benavides was a Green Beret. A year later, in 1968, so 4 years after Roy was nearly killed by that landmine, he was sent back to Vietnam for his second combat tour. And as soon as he got there, the fighting was very intense. On May 2nd of that year, Roy had a day off, and he was spending his day off at a church service inside of their wooden shack they had built on their base. And while he was in there listening to the chaplain, he heard a radio call come out from the communications table that was just outside of the shack he was in, and it sounded like someone was in trouble. And so he ran outside to listen to the radio, and what he heard was this very desperate call from someone yelling into the radio, get us out of here. And in the background of this radio call is just a constant barrage of gunfire. The call for help came from a 12-man Army Special Forces team that had been ambushed by an entire North Vietnamese Army infantry battalion. To put that in perspective, that is 12 Special Forces members, of which many of them Roy knew personally, in the middle of the jungle, where on all four sides there are over 1,000 enemy combatants. As Roy is hearing this distressing transmission come across the radio, he hears overhead the sound of incoming helicopters. And he looks and he sees there's 3 birds that are coming towards their base. And so he runs over to the landing zone to greet the helicopters as they come in. And he can see as they're landing, they are all completely covered in bullet holes. And as soon as they touch down, Roy runs up to one of the door gunners, which is this 19-year-old kid. And he looks kind of dazed. And Roy asks him, what's going on? Where'd you guys just come from? Were you out there at that ambush site? Do you know what's going on with that 12-man team? And the door gunner just collapses into Roy's arms and dies. He had been shot up. These 3 helicopters had attempted previously to fly into the jungle and save that 12-man team, but they had been shot off and had been unsuccessful. Roy helped get the dead door gunner out of the helo, and then he turned to the pilot of this helo where the door gunner was, and he asked him, are you going to go back out there and try to save those guys? And the pilot was obviously so distraught about the death of his door gunner, and also the fact that there are 12 men out there that they could not rescue, that he's chomping at the bit. He wants to go back out there. And Roy immediately volunteers, hops in the helo, and they head out to go rescue this 12-man team. So not only are there only 2 of them, but Roy was so eager to volunteer himself, he forgot his gun. So all he had on him was his knife and some medical supplies. But nonetheless, the pilot just keeps flying towards the ambush site, which was in Cambodia. It was this really dense stretch of jungle. And as they got closer and closer, gunfire started coming out of the jungle towards the helicopter. And so the pilot had to do this kind of constant zigzagging just to avoid getting shot down. And so as they're zigzagging, they notice there's some smoke coming out of the jungle. And it was very clear that this 12-man team is trying to signal to the helo, here we are, come get us, because they can hear the helicopters coming in. And so the pilot tried to fly down and get as close as he could, but anytime he got even marginally close to this team, the rate of fire would pick up so dramatically that the helo was just about to get shot down. And so the pilot began to turn away, and he told Roy, we can't get any closer. We're going to have to get more people in here. And Roy just tells him, no, get as low as you can, and I will jump out into the jungle. And the pilot turns to him, and he's like, you can't do that. You're going to get killed. And Roy somehow convinces this pilot that he alone, without a gun, is totally competent. Just put me down in that jungle, and everything's going to be just fine. And so the pilot said, okay, and he lowered right over the canopy of this jungle, about 100 yards away from where this 12-man team is trapped. And without any hesitation, Roy just leaps off the helicopter into the jungle. Now, you got to understand that where he was jumping was where the enemy was. He was literally jumping, no parachute, no gun, no anything, just crashing through the canopy onto the jungle floor where he'll definitely be surrounded by enemy combatants. And
And so he plummets through the canopy, he smashes onto the ground, he pops up and just starts running through the jungle with enemies on either side of him towards the 12-man down team. And the enemy was so surprised to just see this American running through the middle of the jungle by himself with no weapon that they hesitated for a minute and they didn't open fire on him. But when they did open fire, Roy got shot in the face, in the back of the head, in the leg. They threw a grenade that detonated at his back and sent shrapnel into him, but none of it stopped Roy. He just kept on running until he made it to this downed 12-man team. And when he got to them, they were in terrible shape. They were doing their best to stay behind some trees, but rounds were coming in from all directions, and 4 of them were already dead, and the others that were still alive were critically wounded. In fact, one of the most able-bodied of the surviving 12 had been shot in the head and was missing an eye and could barely see out of the other one, and so he's fighting to stay conscious, and he's generally trying to shoot in one direction, but I mean, that's their best guy at this point, to give you a state of how they were doing. But Roy ran up to this guy, he pulled him down, he gave him a shot of morphine in the arm, and he repositioned him because he couldn't really see, and told him where to shoot his gun. And then under a constant hail of bullets, Roy low-crawled to each of the other living team members and gave them morphine shots, and then began dragging each and every one of them away from the ambush site to this other area where there was better cover, and there was a nearby clearing that he believed a helicopter could land in if the pilot was really daring. On one of Roy's last trips back to the ambush site to get the last few surviving members, he saw 2 other men that were part of this team that had been totally cut off from the main group. And when Roy had jumped into the jungle and ran in, all his adrenaline had kicked up and he just hadn't done a head count. And so he didn't realize there were 2 other people over there. And so without any hesitation, he grabbed a gun off of one of the dead enemy soldiers and just began running towards this down 2-man team. And as he's running, he's shooting wildly in every direction, trying his best to suppress enemy fire, but it's really doing nothing. He's just dodging bullets as he's running. And right as he got close to the 2-man team, a bullet went flying through his thigh, just clean through his thigh, and it didn't slow him down. He got to the 2-man team totally unfazed, and he says, okay, get ready to move. He stands back up and he starts shooting again in both directions and tells them to crawl back to the main unit. And so he stands up and continues to shoot in both directions until these 2 men get back over to the main group. Once they were safely with the group, Roy again ran the gauntlet with this huge gaping hole in his thigh all the way back to the main group. And so now that Roy had a full head count of all of the living members of the downed 12-man team, and he had moved them all to this slightly safer area relatively with better cover and concealment, he threw a smoke grenade into the nearby clearing he had found in hopes that the helo pilot overhead would see the smoke and be willing to come down and land. The pilot that had dropped off Roy had not actually left the area. He had moved away from all the fighting, but he was loitering in case something like this happened. And so he saw the smoke, and without any hesitation, he flew right over, taking rounds the whole time, pinging off the side of his helicopter, and he touched down right in this tiny little clearing. And so as these semi-able-bodied surviving members of this unit began making their way over to the helicopter, Roy began running around a little ways off from the helicopter, picking up rifles off of the dead enemy and shooting back at the enemy, dropping that gun, running over, picking up another one, engaging the enemy over and over again, doing everything he can to try to protect the extract of his men behind him. And once Roy turned around and saw most of the men had made it onto the helicopter, Roy believed it was his chance now to run out and try to collect some of their dead teammates. And so Roy just takes off into the jungle, right into enemy fire. He's got 2 guns in his hands, and he's running. He's trying to engage the enemy as he's going, and then he comes across the first of his dead teammates, and it happens to be one of his very best friends, a man named Leroy Wright. And so he grabs Leroy and begins trying to haul him back towards the chopper, and as he's moving, Roy gets shot again, this time through his stomach. So he tries to keep himself on his feet, and as he's doing that, a grenade detonates behind him, sending more shrapnel into his body, knocking him unconscious. When he came to, he started looking around, and he could see in the tree line dozens of enemy soldiers running towards him. And so he knew if he tried to bring Leroy back to the chopper, that was a suicide mission. And so he had to leave his friend behind. He jumped up, and with all of these enemy combatants just constantly engaging him, he ran all the way back, zigging and zagging back to the main group. And when he got there, expecting to see the helicopter, he found the helicopter had actually crashed onto the ground and was on fire. It had been shot down while he was unconscious. And so he ran over to the flaming shell of this helicopter, and he saw the pilot had been killed, but some of the men that had climbed on, the men that he had just rescued, they had survived the crash and subsequent explosion. And so Roy just leaps into the burning vehicle and starts throwing these survivors out. Then he leapt back out, he picked up a gun, continued to engage the enemy, and then began picking up these wounded men and dragging them even farther farther away to another area that was safely away from this crash site, because he knew if he didn't get all these people away from the crash site, pretty soon mortars are going to come raining down on this area, because their enemy is going to want to kill any of the people that are going to try to rescue the people that were on the helicopter. And so Roy finally gets all of the survivors over to this new area, and he's looking around and he can see there are still hundreds of enemy fighters that are not that far away from them, just constantly engaging them. And Roy's doing his best to grab guns off the ground and shoot the enemy, but there's just too many of them. And he's looking around at his team and everybody's on the brink of death. And so is Roy. He's just functioning on adrenaline at this point, and he thinks to himself, the only way we can get out of this is if we call in what's called a danger close airstrike. So what you need to understand about how airstrikes work in a combat zone is there's someone called a controller that is on the ground directing the aircraft overhead. They're the ones effectively telling the plane where to shoot. And so a danger close airstrike is when the controller tells the aircraft overhead, I want you to drop a bomb right here, giving them the grid coordinates, but where they're telling them to drop is basically in the same position where the controller is. And you'd only do it if you're being overrun. It's a way to ensure your enemy gets taken out, even if that means taking yourself out. Now, the goal of the controller is not to drop the bomb on themselves or their team. The goal of the controller is to get that airstrike as close as you can to your position without killing you. And so Roy, who's physically wrecked, he's getting shot at, he's got bullet holes all over him, it's totally chaotic. He pulls out his map, he calmly finds his grid coordinates, he calls it into the aircraft overhead, and he calls in a beautiful precision napalm strike. It does not affect his team at all. He calls in multiple gun runs. None of them affect his team, despite them all being considered danger close airstrikes. And so Roy just continuously called in attack run after attack run, taking out enemy combatants all around them, completely suppressing the fire. But at some point, the aircraft overhead ran out of fuel and had to leave. And at that point, the surviving enemy combatants, which still numbered in the hundreds, they popped their heads up and they unleashed a hellacious volley of fire in which Roy again got shot clean through the leg. And so now Roy's looking around and he's realizing they're pretty much out of options. They don't have aircraft overhead. Roy's basically out of ammunition and there's no dead guys' guns around for him to grab. All of his team members are basically on the brink of death. And so Roy's thinking to himself, any minute now, we're going to get overrun. And so he crawls to each of his surviving teammates and he gives them one last shot of morphine to at least make their death painless. And then at the 11th hour, another helo comes blazing into the jungle and opens fire on the enemy, pushing them back. Roy is immediately invigorated and motivated because now he sees an opportunity to potentially survive this. And so once again, he grabs his teammates and begins schlepping them over to the helicopter. And after he believed he got the last of them on board, he turned and saw two of his teammates had fallen down farther back in the jungle and the enemy was closing in on them. And so Roy, like always, without any hesitation, just starts running towards them. And as he's just about to reach them, an enemy soldier that had apparently run out of ammunition leapt out of the jungle and smashed Roy on the side of the head with their rifle butt, fracturing his skull. And so Roy falls to the ground and the soldier jumps on top of him and smashes his face, breaking his jaw. And then the soldier turns his rifle around. There's a bayonet on the front side and he begins impaling Roy over and over again. And Roy, like out of a movie, grabbed the rifle, pulled it out of himself, threw the soldier on the ground, jumped up, got on top of him, drew his Bowie knife, and proceeded to kill this soldier. And after he was done with that, he ran over to the two down men. He grabbed one of them with his left hand. He picked up a rifle with the other. And as he's dragging this guy back to the chopper, he shoots and kills two more enemy combatants. So he finally gets this guy back to the chopper. He runs back, gets the last guy, throws him back in the helicopter. And then finally, Roy is the very last living American to hop in the helicopter, and the helicopter takes off. On the helo ride back, Roy was in very rough shape and had to literally hold his insides inside of his stomach. And so when they finally landed back at base and Roy was hauled off of this helicopter, he wasn't moving, and the doctors and nurses didn't really even know where to start with him. He had so many injuries. He had 37 significant holes in his body from gunshot wounds, from bayonet wounds, from shrapnel. And so they started trying to treat him, but there was no heartbeat, no pulse. And so they declared him dead. Roy's body was moved into a body bag. And
as the doctor was zipping it up again, Roy spit in his face. Because Roy had no other way to communicate. His jaw was so badly broken from that rifle butt, he couldn't move his jaw, and his eyes were sealed shut from all the blood on his face that had dried. And so his only way to communicate was to spit. And so unbelievably, Roy was still alive. And so they took him out of the body bag and they shipped him to Japan for intensive surgery. And then he was transferred to Texas, where he spent a year rehabbing from his severe injuries. Roy was immediately given the Distinguished Service Cross and was put in for the Congressional Medal of Honor, which is the U.S. military's highest award for valor. But the paperwork took a really long time. And so Roy was not actually given the Congressional Medal of Honor until 1981. Of the 12 men that were trapped in that jungle, 8 would survive, all thanks to Roy Benavidez.
Thank you. Thank you. A lot of people call me a hero. I appreciate the title. But the real heroes are the ones that gave their life for this country.
Roy passed away in 1998 as a result of complications from diabetes. He was 63. Michael DiPolito grew up in a very rough neighborhood in South Philadelphia where violence, drugs, and prostitution were just normal parts of everyday life. At a young age, like his parents, Michael became an alcoholic. He also developed a very serious drug addiction that he paid for by selling drugs. Michael would eventually drop out of high school, and not long after that, he became homeless and was living out on the streets, sleeping in abandoned buildings at night to stay warm. In 1993, when Michael was still in South Philadelphia, he was arrested for the first time. He was charged with possession of an unknown drug as well as intent to distribute this unknown drug. Court records don't specify what drug this was. However, Michael just did not show up for court, and so a warrant was put out for his arrest. Michael would somehow manage to evade police capture, and by 1997, he had fled South Philly altogether and landed in South Florida in a town called Boca Raton. Shortly after arriving there, Michael was arrested for a second time, this time for offering an undercover police officer $15 in exchange for sex. Michael would plead guilty to soliciting prostitution, however, he would just get released. A year after the prostitution arrest, Michael was sued by a former girlfriend named Karen Tan, who claimed he was the father of her son, and so he owed her child support, and Karen had a DNA test that backed up this claim. However, Michael, again, would just not show up for court, and before long, Karen just gave up and dropped the lawsuit. Michael was likely very relieved when this happened, because at the time, he was making almost no money through a temp agency. And so after this lawsuit gets dropped, Michael decides, I need to go out and make some real money. And somehow, on his quest to find a more lucrative opportunity, Michael was introduced to associates of the Bonanno family. And the Bonanno family is one of the infamous 5 families that dominates organized crime across the United States. They are literally the Italian mafia. And after the mafia met Michael, they took a liking to him, and they did offer him a more lucrative, albeit illegal, opportunity. They gave him a role inside one of their so-called boiler rooms. A boiler room is not literally a boiler room. Instead, it's a group of fraudsters that use high-pressure sales tactics to steal money from unsuspecting victims. Typically, the way it works is the fraudster will cold call someone and they will tell them that they have this great get-rich-quick scheme, but you gotta give me your money right now if you want to be a part of it. And so when the victim says, okay, that sounds great, and they wire the money along, the fraudster just steals their money. Michael, who was very charismatic and a natural salesman, got really good at tricking people into giving him their money. And so eventually, Michael realized he could make a lot more money if he started his own boiler room, where his commission could be much higher on the money he stole. And so fairly abruptly, he left the mafia's boiler room. We don't really know how they reacted to this. And Michael would set up not 1, but 2 boiler room scams of his own in South Florida. And by 2002, he had pocketed $155,000 of stolen money. However, he had spent virtually all of it on fancy hotels and cars and phone sex. But the good times would not last for Michael, because in 2002, the police caught on to Michael's boiler room scams and they raided them, and Michael was arrested for a third time, except this time he would go to court, he would stand trial, and he would be sentenced to 2 years in prison, 28 years of probation, and he would be ordered to pay back the $155,000 that he stole. Michael would only serve 7 months of his 2-year jail sentence, but that was more than enough to leave a huge impact on him. Michael hated prison. He hated every second of it. And so during those long sleepless nights that he was laying awake in his cell, he made a promise to himself that when he got out, when he was released, he would never, ever come back. And so in 2003, when he was released, he immediately entered a sobriety program. He also started going to the gym every morning, and he began studying for his GED, which is a high school equivalency test because he didn't get his high school diploma. After he successfully earned his GED a couple of months later, he would also start a legal business. It was a digital marketing firm that was called Mad Money Inc. Over the next several years, Michael would do his very best to stay on the straight and narrow and not get in trouble. And for the most part, he did that. By 2008, Michael was still sober, despite a few setbacks, and he was still very focused on his physical fitness and his health, and his business, Mad Money, was doing quite well, earning him nearly $100,000 a year. But his love life had become a bit messy. Michael had gotten married back in 2007 to his longtime girlfriend named Maria Luongo, who had stood by him when he went to jail. But that year, in 2008, when Michael was 38 years old, he cheated on Maria with a 26-year-old real estate agent named Dalia Mohammed, who he met at a Starbucks. And instead of their affair being a quick fling, as they likely both intended it to be, Michael and Dalia quickly fell in love. And when that happened, Michael went to his wife Maria and he told her, and then he divorced her. Just 3 days after the divorce finalized, Michael and Dalia went to the courthouse and they got married. The newlyweds would move into a brand new condo that Michael had purchased for them in Boynton Beach, which is a beautiful town in South Florida. And for a time, their life was perfect. They knew it was a little outrageous the way they had met each other and how quickly they had fallen for each other, but they didn't care. They got along great and they were excited about the future. But their perfect life would not last long. On the evening of March 12th, 2009, so only about a month after they had gotten married, Michael and Dalia were at home in their condo when they heard a knock on the front door. And so Michael went to the door, he opened it up, and much to his surprise, standing on the other side was his probation officer, and behind him was a whole bunch of police officers. And before Michael could even ask what was going on, the probation officer told Michael that they had received an anonymous call tipping them off that Michael was selling steroids and ecstasy pills and other drugs out of his condo. Michael would tell the probation officer that there was no way that was true. He is not selling any drugs, he's sober, he's not doing that. And so eventually Michael just stepped aside and said, "Please come in, search my condo. I have nothing to hide." And so sure enough, the police, they would go into his condo, they would search it, but they wouldn't find anything and they would leave. And so after the police had gone, Michael and Dalia found themselves just standing in their condo, completely dumbfounded. But instead of trying to get to the bottom of it right then and there about who had called and why, they just decided it was best for them to just leave their condo for the night and go stay at a nice hotel. And so they packed up some bags, they left their condo, which was a total mess from the police search, and they went to the hotel and they had a nice night together. The next morning, when they got up and headed down to the parking lot, they saw up ahead, standing around Michael's car, was Michael's probation officer as well as several other police officers. And so Michael and Dalia are looking at each other like, what is this, again? And so they hustle on over to Michael's car, and before they can even plead their innocence to Michael's probation officer, he stops Michael and just says, "Look, we got another anonymous call, this time telling us that you are selling drugs out of your vehicle, and so we need to search it." And so Michael is just totally beside himself, but he says, "Look, go ahead, search it. There's nothing in the car." And so sure enough, the police would open up his car, they'd rip it apart, but again, they wouldn't find anything. Over the next couple of weeks, the only thing Michael and Dalia ever wanted to talk about was what the heck was going on. Who is placing these anonymous calls claiming that Michael was selling drugs out of the condo and out of the car? It just didn't add up.
They wanted to believe that this was all just one big mistake, but in the back of both of their minds, they were thinking about Michael's very checkered past and his previous dealings with the mafia and with people he had clearly ripped off. And so maybe there was someone in his past that was looking to get back at Michael and maybe get him arrested and sent back to jail. Fast forward to March 29th, so 17 days after that first raid on their condo, and that night, Michael and Dahlia had been eating dinner at a restaurant, and when they left and headed out to the parking lot, once again, standing around Michael's car were several police officers clearly waiting for him to return. And so without even needing to ask why they were there, Michael and Dahlia, they go over to them and they just start pleading with them to understand that this is a setup. We do not have drugs in this car. We don't know what's going on here. Please, you gotta understand that someone's doing this to us. But this time, when they searched his car, they would find something. Before we go any further, I want to tell you about today's sponsor, Experian. Back when I was just a young buck in college, I was broke. And so naturally, I took out a credit card with a $5,000 limit and immediately maxed it out on buffalo chicken calzones and beer. Now, as soon as my card got declined, I didn't pay it off. Instead, I just took the card, tucked it back into my wallet, and forgot about it. But the bank did not forget about my $5,000 debt, and my failure to pay it back wrecked my FICO score. A FICO score is a type of credit score. Over the last 10 years, I've been able to rebuild my credit score, but it has been a slow and painful process. And so my suggestion to you is to avoid the unpaid beer and calzone credit trap and just closely monitor your credit score. And with Experian, you can do that for free. In addition to closely monitoring your credit score, they will also send you alerts anytime your credit changes. Experian also offers a dark web scan. If you've ever been the victim of a data breach, and you may not know if you have or not, your information potentially could live in the dark web, and that's a place where criminals could use it to commit fraud, and if that happens, it'll wreck your credit along with a bunch of other horrible things, unless you catch it and report it. And on that, if you do find inaccuracies on your credit report, you can easily submit disputes and track those disputes on Experian's online dispute center. It is time to take charge of your credit. Get Experian credit monitoring, alerts, your FICO score, and that dark web scan all for free. Just go to Experian.com/MrBallen. Again, that's EXPERIAN.com/MrBallen. Okay, back to the story. After searching Michael's car, the police would find a small bag of cocaine stuck inside of a cigarette carton tucked underneath his spare tire in the trunk. And when Michael saw them pull the cocaine out, he began to cry because he knew, even though it was not his and he had not put it there, that he was going to jail because he was going to get arrested for possession and he was on probation and he was screwed. And so he just begins crying and pleading with police to understand that the cocaine was not his. He swears it's not his. Meanwhile, Dahlia, she's looking at the drugs and now she's second guessing herself. Is Michael lying? Is he actually selling drugs? And he's been lying to me too? But when she sees her husband crying hysterically and looking so sincere, she believes that he's got to be telling the truth. And so pretty soon she was standing beside Michael and pleading with police as well to let them go, that this was totally just a setup. And amazingly, these police officers who were aware of the previous raids on Michael and Dahlia's property, they told them, look, we do think this is pretty suspicious that somebody keeps calling in about you selling drugs and now magically the drugs are in your car. And so what we're going to do is we're going to confiscate this cocaine. We're not going to arrest you. Instead, go home, be safe, call us if you see anything strange, you hear anything strange, and we're going to begin investigating to figure out who is making all of these calls. And so Michael and Dahlia were totally relieved to hear this, but at the same time, they were kind of terrified because clearly whoever was looking to get Michael in trouble now was prepared to break into his property in order to do it. And so what was stopping them from breaking into their condo and planting drugs in there as well? And so after these police officers left, Michael and Dahlia hopped in the car, they sped back to their condo, and they went inside and they searched it top to bottom, looking for any sign that anyone had recently been in there or if there were drugs or anything illegal inside of their condo. And after looking and finding nothing, they just locked their doors, shut their windows, shut the blinds, and just prayed that the police would be able to quickly identify who was doing this to them and make them stop.
But over the next few months, the police would not figure out who this anonymous caller was because the caller stopped calling. And so for a little while, Michael and Dahlia were convinced that the whole ordeal was over and done with, and they basically returned to their normal lives. But on August 5th, 2009, roughly 4 months after the cocaine was found in Michael's car, the anonymous caller would come back with a vengeance. On that morning at around 5:45 a.m., Dahlia left the condo, leaving Michael in bed, and she headed out to the local gym to get a workout in. Around 6:30 in the morning, she stepped off the treadmill and she looked at her phone and she saw she had a missed call from a number she didn't recognize, and this number had left her a voicemail. And so she calls her voicemail, she puts it to her ear, and as she's listening, her heart starts to race because it was a Boynton Beach detective telling her there had been some sort of incident at her condo and she needed to come back right away. Terrified, Dahlia grabbed her things and she ran out of the gym, she got in her car, and she called this number back. And when the detective picked up, she tried to get more information from him about what this incident was, what happened. And the detective would only say that it involved her husband, and he would explain everything when she came back. And so in a total state of shock, Dahlia turned on her car and she sped out of the parking lot and she headed back towards her condo. And when she turned onto her street and saw her condo, she hit the brakes and just stared. In front of her condo were all these police cars with their lights on, and police officers were walking around, and yellow crime scene tape was lining the outside of her property. And inside of the taped off area, there were all these crime scene photographers taking pictures of her condo. And so as Dahlia is sitting in her car at the top of the street, just staring at this crazy scene she's seeing, one of the Boynton Beach police officers sees her and walks up, and after confirming that she was Dahlia DiPolito, he said to her, leave your car here and come with me. And so Dahlia, who knows obviously something bad has happened but really doesn't know the extent of it, she puts her car in park, she gets out, and she begins walking with this police officer over towards this cluster of 3 people that are standing right in front of her property. And it would turn out one of them was the detective who had called her on the phone. And so Dahlia's led over, and that detective, as soon as he sees Dahlia, he walks over to her and he says to her very matter-of-factly that someone had called about a disturbance in their condo, and shots were fired, and unfortunately, her husband, Michael, was dead. Dahlia, who was totally hysterical, was gently led away from her condo into a nearby police car, and they would drive her to the police station where they would sit her down and begin asking her questions about her husband. And they would say to her, look, I know you just found this out, but we gotta figure out what could have happened because a killer is on the loose. We need to find this person and stop them. And so at first, the conversation was really just Dahlia crying and the detective kind of calming her down. But eventually, she would tell the detective about the anonymous caller who kept calling the police and claiming Michael was selling drugs, and how she and Michael suspected that, probably the anonymous caller was connected to someone from his past, maybe someone from the mafia, or maybe one of the victims of his boiler room scam, or it could be any number of other people that Michael had done wrong in the past. And so the detective, he's taking diligent notes and he's listening to Dahlia, and then at some point in a break in the conversation, he says to Dahlia, okay, it's time to get serious. I need to know if you know this guy. And so Dahlia, she was kind of looking down and she looks up, confused what he's talking about. And then the door opens and this huge guy in handcuffs walks into the room.
Come here. Bring this guy in here. Get over here. Get over here. You know who this guy is?
No,
You've never seen him before.
I've never seen him before. Ever.
Do you know her?
Put your head up and look at her.
Put your head up.
I've never seen him.
What were you doing coming out of her house? Get him out of here.
It would turn out Dahlia was lying. She did know who that guy was. Almost immediately after marrying Michael 6 months earlier, she had stolen $200,000 from him, but apparently that wasn't enough for her. She needed the rest of Michael's money as well as his condo. And so she had been the anonymous caller. She was the one calling the police and tipping them off that Michael was selling drugs out of the condo and out of his car. She was the one who planted the cocaine in the back of his car because she wanted him to get arrested because he was on probation and he would go back to jail for a really long time. But when her efforts failed and Michael did not get arrested and so did not go back to jail, Dahlia moved on to Plan B. She reached out to one of her ex-boyfriends and she asked him, "Hey, do you know any hitmen that could murder my husband?" And the ex-boyfriend at first didn't think she was serious, but when she kept asking him about it and began offering to pay and really was making it clear that she wasn't joking around, the ex-boyfriend basically told her, "No, I don't know any hitmen." And then he, the ex-boyfriend, called the Boynton Beach Police Department and told them about Dahlia and her plan to hire a hitman to kill Michael. And so when the Boynton Beach Police Department found out about this plot, they immediately had one of their undercover agents pose as a hitman and set up a meeting with Dahlia. And so the undercover agent was that huge guy in handcuffs that was led into the room with Dahlia. And so Dahlia goes to meet the undercover agent, the fake hitman. She gets into his car and there's a hidden camera in the back seat that's filming her the whole time. And she's caught on camera saying she wants to kill her husband. She gives money to the undercover agent. And then as she's about to get out, the agent turns to her and he says, "Are you sure you want to do this? Because as soon as you leave, it's done. I am going to kill Michael and you can't stop it." This is Dahlia's reaction.
There's no changing, no, there's no, like, I'm determined already. I'm positive, like, 5,000% sure, like, no, when I say I'm going to do something, I'm going to do it. Like, as soon as he told me, listen, I need the money from you, I went, I grabbed it right away, like, we were good to go. Like, with me, you're not going to have a problem, you're not going to have an issue.
And so the Boynton Beach Police Department, they have all this information about what Dahlia thinks is going to happen, and they decide they can use this information to set her up in the most elaborate way possible. And it just so happened the very popular true crime TV show, Cops, was filming in the area. And so the Boynton Beach Police Department allowed Cops to be a part of this elaborate setup. So they got to film everything that happened. So on the morning of August 5th, Dahlia got up and left her condo at 5:45 a.m. and headed to the gym, knowing, at least in her mind, that the hitman would be coming to her condo right after her, breaking in and shooting her husband twice in the head, because that was the plan they had come up with that was captured on film. And so after the police see her leave at 5:45 a.m., because they were monitoring the condo, they rushed in, they knocked on the door, and they got Michael to come downstairs. And he had no idea his wife was trying to kill him. And so he comes to the door, he's totally confused, but he goes with them and he's kind of ushered off to the police station. And then for about the next hour, the police set up a very convincing fake crime scene right out front of the condo. And then once it was all set up, that detective called Dahlia and left her a voicemail saying that, there's been this incident, you need to come back to your condo. And then a couple of minutes later, when Dahlia called them back and said, "Okay, I'm coming back to the condo now," that's when the TV crews for the Cops TV show, they kind of set up in the bushes and got ready to film what happened next.
Listen, we had a report of a disturbance at your house, and there were shots fired. Is your husband Michael? Okay, I'm sorry to tell you, ma'am, he's been killed. He's been killed, man. I'm sorry.
No, he's not.
Listen.
No.
Try to calm down.
No.
Listen, right now we need to get you to the station.
No.
We need to get you to our police station.
I want to see him.
I can't let you in, man. We have to do our job.
After the fake hitman was pulled out of the interrogation room after Dahlia had said, "Oh, I don't know who he is," the detective just stared at her in total silence for a minute. And then he broke the news that he totally knew all about her murder plot and that she was going to jail.
You're going to jail today for solicitation of murder. You're under arrest. That's an undercover police officer. Everything has been recorded. You were photographed in the convertible when you sat in his car in the front of CVS. What do you want to do? What do you want to do here?
I didn't
Dahlia?
do anything.
Listen to
I
me.
didn't do anything.
You're going to
I didn't
jail.
do anything, please. I didn't do anything.
Tell me you didn't do anything.
I didn't do anything.
You're going to jail today. As soon as I'm done,
Oh my God.
they're going to come in here and handcuff you and take you to the Palm Beach County Jail, book you for solicitation of first-degree murder on your husband. Your husband is well and alive.
Thank God.
Oh, yeah, thank God.
Please, can I see him?
No, he doesn't
please?
want to see you.
I so wanted to see him.
He doesn't want to see you.
Please.
After Dahlia was arrested, she was still sitting in that interrogation room when the Boynton Beach Police Department made a special point of walking Dahlia's husband, Michael, past the open door so she could see him. Here's her reaction.
Oh my God. here, please. Come here. Mike, come here. Come here, please. Come here.
Can't fix it.
Why not? I didn't do anything
I
to
heard
you.
you.
Mike, come here, please. Come here.
Okay, like, we'll take it back to booking, please.
Dahlia was initially sentenced to 20 years in prison for what she had done, but after a retrial because of jury bias, her sentence was reduced to 16 years. So that's going to do it. If you got something out of today's episode and you haven't done this already, please ask the like button if you can borrow their car for the week and then spend that week driving around picking up as much roadkill as you possibly can and packing it into their trunk and into their back seat and then return their car. Also, please subscribe to our channel and turn on all notifications so you
marks on the tile, and I forgot the rest. You said don't look away, like you knew my name. My heart went barefoot, then it learned that flame. One step closer, then you pull back. Palms on my skin, and I want all that. One step closer, now I can't hide. You got that wow, wow.
Don't miss any of our weekly 1 or 2 video uploads. We now have a podcast called MrBallen Podcast, and we put out brand new, never before heard podcast exclusive episodes on Monday mornings. And then on Thursday mornings, we put out remastered audio from popular YouTube videos. Again, it's called MrBallen Podcast, and it's available on Spotify, Apple Podcasts, Amazon, Google, basically anywhere you get your podcasts, you can find it there. We have 2 additional YouTube channels. One is called MrBallen Shorts, where we upload random short videos and lost episodes, and the other channel is called MrBallen en Español, and it's a Spanish language channel. We